Good afternoon, and thank you for joining us, everyone. I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Jason Thorne, the city's Emergency Operations Center Director. The provincial proof of vaccination policy is a critical step to keeping the community safe and the COVID-19 transmission low. So the Ontario government has launched the Verify Ontario app, which allows business owners to scan the enhanced vaccine certificate QR code, verifying a person's eligibility to enter certain businesses and organizations based on their COVID-19 vaccination status. So you can now download the enhanced vaccine certification through the provincial COVID-19 portal, or by calling the Provincial Vaccine Contact Center at 1-833-943-3900 to have your enhanced vaccine certificate emailed or mailed to you. This new tool will help streamline vaccine verification for those choosing to dine indoors or access public facilities and attend events and so much more. Tiger Cat games, gyms, etc., all require vaccination verifications at this point. And I've just gone through the process of downloading my enhanced vaccine certificate. It took no more than 5 minutes, and it will allow me to show my vaccine verification quite easily at all the things that I want to attend in our community. So this provides ease of access, both as a patron and to those businesses that are doing their best to verify the information prior to seating their guests in their establishment. So I encourage you, take a few minutes today and download the enhanced vaccine certificate on the provincial portal website. As we near the end of October, Halloween is quickly approaching. So trick-or-treating is a Halloween tradition that so many children and youth look forward to each year, young and old. Children and youth have had to adjust and be flexible, just like the rest of us. So we must all continue to do our part to keep one another safe. So a reminder to those planning to go trick-or-treating on Halloween, stay indoors as much as possible. Do not crowd or overcrowd doorsteps, or better yet, those handing out treats could bring the candy to the end of the driveway so it is accessible to everyone. Keep your interactions brief. Use sanitizer often, especially before and after handling your face covering or touching frequently touched surfaces. And please stay home if your symptoms, even if you have mild symptoms, please stay home and don't interact with others, just to avoid any potential spread of the virus in our community. For those choosing to hand out treats, keep those interactions with the trick-or-treaters brief. Consider wearing a face mask covering when physical distancing can't be maintained, and do not ask trick-or-treaters to sing or shout for their treats. Although that's a common tradition, probably not a good idea to do at this point. And of course, clean your hands often and thoroughly throughout the evening if you can. So I'll now pass it over to the city's Emergency Operations Center Director, Jason Thorne.
Thank you, Mr. Mayor. I just have two brief updates from the Emergency Operations Center this afternoon. And first, I'll provide an update with respect to enforcement activity related to the COVID bylaws and provincial COVID regulations. So since the provincial vaccine verification mandate came into effect on September the 22nd, bylaw officers have now inspected about 354 establishments across the city. And this includes continuing to go to those establishments who are flagrantly disregarding the rules, and a reminder that these establishments do face fines ranging from $750 to $1,000. The good news is that most businesses and the vast majority of businesses do continue to comply with those new vaccine verification requirements. However, we have now laid 5 charges with respect to non-compliance with the passport requirements since October the 3rd. We're also seeing several businesses facing charges for face covering violations, which remains a requirement for all businesses and all patrons. So a reminder that wearing a mask or face covering is one of the most effective ways to stop the spread of COVID. So we do want to remind patrons and remind business owners that the face covering bylaw is still in effect, and fines are being issued where we find non-compliance. My second update relates to the city's recreation facilities. So a reminder that proof of vaccination and identification is required at the time of entry into any of our recreation centers and arenas. As the mayor noted, with the rollout of the QR code system, our rec centers are being outfitted with readers, so they'll be able to scan and read those QR codes. We are testing those out now, and they are intended to be in place and operational for when the provincial go live date happens on October the 22nd. Similar to the hard copy vaccination certificates, staff are only visually verifying through the screeners that the vaccine verification is in place. No information is being kept or copied. So that does mean that even with the QR code, patrons will have to scan in their vaccine verification each time they enter or re-enter one of our recreations or arena facilities. There are a number of details related to our recreation facilities, as well as what programs are available up on the city's website. And that is my update for this afternoon, and I will turn things over to Dr. Richardson.
Thanks very much, Jason. So this week is actually National Infection Control Week. And of course, this has been a very important activity throughout the pandemic. So I want to take a moment to acknowledge both our Hamilton Public Health Services, infection prevention and control staff, and those across our community in our hospitals and our long-term care homes, right across the community for their critical and tireless work that of course, long preceded the pandemic itself, but of course has been absolutely invaluable as we've worked through the COVID-19 response here in Hamilton over the last 20 months. So we do have in Hamilton Public Health a number of people as well who are working in infection control who normally would have other jobs, and they've been redeployed. And so it's been great to have them assisting us in that response, and of course, assisting our community ultimately as well. And these folks, both in public health and across our hospitals, our long-term care homes, are often unsung. They're often the ones just in the background working away. And they have been working very hard throughout to ensure that people are protected in these settings, both staff and those who live and work in those settings. So thank you to all of those infection control practitioners across Hamilton. In terms of cases today, we're at a total of 25,045 cases as of today, with a net change of 18 cases from yesterday. Our levels do continue to be highest amongst those 0 to 59 years of age, as has been the case now for quite some time. Our 7-day moving average is reported at 23 cases, and our weekly incidence at 27. Our most weekly reproductive number is set at 0.91. Our average number of daily new hospitalizations is low at this time, which is great. And we currently have less than 2 new hospitalizations per day. The average number of deaths also is remaining very low. Our percent positivity, though, remains higher than the provincial average. Although it's been trending downwards, it's still sitting at 2.4%. And we have 7 active outbreaks, with 3 new outbreaks being reported today. As we've talked about, these outbreaks do tend to be smaller than what we had experienced in the past. And of course, all the details can be found on our COVID-19 dashboard. So in terms of the Thanksgiving weekend, because I know that's been a common question that we've heard over the last several days, it's still a little too early to tell. As you know, it takes about 10 days, 2 weeks after the end of the weekend to really understand what might have happened, how much transmission might have occurred. And so we're continuing to watch that quite closely. We're very glad to have a new mobile testing service going on through our Hamilton Paramedic Services, and they're taking part at a couple of locations here in Hamilton. They're working with other partners as well, and testing is now available for residents at the Dominic Agostino Riverdale Community Center at 150 Violet Drive on Mondays from 10 a.m. to 2 p.m. That's going to go on for the next 3 weeks on October 25th, November 1st, and November 8th. The second site that these partners are operating with is a new location at the David Braley Health Sciences Center. So that's at 100 Main Street West in the parking lot at King and Bay. And that is going to be operating on Tuesdays from 10 a.m. to 2 p.m. And so testing in that site will go on October 26th, November the 2nd, and November 9th. And at both of these locations, there's no appointments needed. You can just walk up to have testing done. Now, in terms of who can receive testing there, it is those who fall within the Ontario provincial guidelines. These mobile community testing sites are not permitted to do and will not do any swabs or testing that's needed for travel or to attend or participate or gain admission to a public event. And so information about those reasons for testing is all available at www.hamilton.ca/COVID testing. And just want to acknowledge again our Hamilton Public Health Services partners and our partners right across the Hamilton COVID response table and our colleagues here at the HSR at the City of Hamilton. On the vaccination front, we're now at 849,965 vaccines locally having been given out, meaning an estimated 84.6% of Hamiltonians born in 2009 or earlier at this point have chosen to receive a vaccine, and nearly 80%, we're at 79.9%, I so want to say 80%, have chosen to become fully vaccinated. You may have seen our scars and forecasting that we shared at the Board of Health meeting just yesterday, and we do remain cautiously optimistic about COVID-19 rates in Hamilton. We can't, of course, say with absolutely certainty exactly what's working, but our current low state of viral transmission is likely due to that combination of rising vaccination rates and as well the continued adherence to public health measures like masking, like physical distancing, like staying home when sick, and of course some degree of decreased mobility that we have seen since the new policy measure around access to spaces only for those that are vaccinated. So we do all owe a huge thank you to our community members for rolling up their sleeves and getting fully vaccinated. And of course, to our local businesses, as Jason was just talking about, by far the vast majority are continuing to adhere very tightly to the proven and effective public health measures that are really making a difference. We have seen, of course, how lifting those public health measures early can bring about an upsurge in COVID-19 and put both our vulnerable community members at risk as well as our healthcare systems. And so we do await the announcements from the province on their revised roadmap to reopening, including the timing, the plan, the potential for lifting of public health measures. But we've really had some hard-won progress here in Ontario and Canada. They're working on it as well, but particularly here in Hamilton. And it's important that our individuals in our community and our businesses in our community not let our guards down. So as the mayor was saying, all of those public health measures, masking, physical distancing, staying home when sick, getting tested, washing hands frequently are as important as ever. Of course, vaccine is among those. And so we are continuing with our vaccination strategy, taking our vaccines out to community clinics, particularly in areas with lower vaccination rates and those who have been disproportionately affected by the virus. And so you'll see our hyper-local approach this week coming to places like the Nawasa Food Bank on Britannia Ave, Beverly Community Park, and Christie Lake Conservation Area, along with clinics at various Hamilton public libraries. We're so glad to see how well those are working for our community, and of course in local recreational centers as well. All of our vaccine clinics, their operating hours can be found at hamilton.ca/getyourvaccine, and we update that as regularly as we can with any new information or clinic sites that become available. Thanks very much, and over to you, Mr. Mayor.
Thank you, Elizabeth, and thank you, Jason. And again, let's all be mindful of the role we all play in helping to reduce the spread of COVID-19. And, things are better, and that's the good news, but it's still, there's good reason to be cautious and careful so that we don't undo all the good work we've done to date, and certainly continue to encourage everyone to get the vaccine at the earliest date. And more and more people are doing that. And certainly we can see evidence of things improving as a result of all of that good work. So please keep up the good work. Also a reminder to get your flu shot this year. We're heading into flu season, and with more interaction, we can anticipate more cases of flu this year, I imagine. And so probably a good time to get your flu shot at your earliest convenience. So everything we're doing is to protect our loved ones, our communities, our health and well-being, and as a community, and are protecting our businesses so that we can stay open and keep them thriving. And so far, things are working as they should, which is, I think, a testament to all of your good work out in the broader community, whether a business or an individual. So thank you for all that great work. I'm going to turn it over now to Jasmine for any questions from the media. Jasmine?
Great, thank you, Mr. Mayor. We have 4 media joining us today. As usual, we'll start with 1 question and 1 follow-up for everyone. The first question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my questions. This first one would be for Dr. Richardson. We heard yesterday a little bit about the planning underway to eventually roll out vaccination to kids aged 5 to 11. Heard that there's apparently going to be 2 mini mass clinics planned, as well as a couple other things. Just wondering if you can tell us anything about where those might be, whether they'll be exclusively for kids, or is it too early in the planning phase at this point, as well as kind of what else public health has planned?
Absolutely, Lisa. You know, we're very excited to be getting ready for these clinics for kids. This is a group that is vulnerable in our community. We so much want to make sure that they stay in school throughout the year. So we have our colleagues at McMaster's Children's Hospital, the school boards, everybody is contributing to the planning for these. And we are planning to do 2 mini mass sites. We've seen those have worked really quite well for kids, but also, of course, they'll be able to go to different sites across the community. So we're just finalizing details on those, looking at what is going to make the most sense, depending at what stage we're at in the vaccination rollout and when that actually gets approved to move forward. So you'll hear more details in the upcoming weeks, I'm hoping.
Okay, thanks. And my second question is also for you, and it's a little bit related to that, as well as what the mayor was touching on at the very end there about the flu vaccine, getting that going. And we're kind of hearing that there will be more flu shots ordered. There's expected to be more of a demand because of, you know, the flu season and the COVID is out there. So just wondering about balancing the flu shot rollout with the potential increased demand, if that kind of is happening at the same time as the vaccine is available for kids.
Yeah, Lisa, you're really pointing out some of the complicated things as we move forward with additional vaccines. And one of the things that was really good to help simplify things was when the National Advisory Committee on Immunization came out and said, you can give the COVID-19 vaccine along with other vaccines, influenza vaccine being one of them, but of course also other vaccines like the usual childhood vaccines when kids become eligible as well. So as we're moving forward, the flu program always rolls out to those that are most vulnerable first. And so it goes to long-term care homes, retirement homes, and then to primary care practices and others to vaccinate those who are at higher risk of the complications of flu. And then, of course, goes out to the general public altogether. So we're continuing to refine our approach around vaccination. That's part of what I was alluding to when I said it all depends on exactly what stage we're at in terms of the rollout. But certainly we know that there's pharmacies now that are going to be able to start giving that flu vaccine. Our primary care partners are going to be there to give the flu vaccine. And we're going to continue to look at how we could potentially incorporate the flu vaccine into those clinics as we go forward. So that's part of the planning my colleagues are doing. And we'll have more details on that soon. From in terms of the number of doses, yes, absolutely. Everybody is aware of the increased uptake that happened last year, which was great to see. And of course, we had lower rates of flu, partly because of these continued public health measures, which decrease the likelihood of transmission of flu as well. So between having more vaccine hopefully being used this year, as well as continued measures, we're hoping rates will stay low, but people are concerned that we may get a bit of a rebound, which is seen in some other jurisdictions.
Thank you, Dr. Richardson. Our next question is to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi, thanks so much for taking my questions. My question relates to the McMaster homecoming party that happened earlier this month. And I was wondering if you can tell me, I think Dr. Richardson, if there was any COVID transmission that was traced back to that.
Hi, Maria. I don't have anything in relation to that on hand with me right now. That's something we can get back to you on. Jason, I don't know if you wanted to make any other comments about that particular event as well.
So I can say that in terms of enforcement activity, I do know that police are continuing to pursue some of the infractions that took place and continue to look at opportunities to lay charges. But I'm also not aware of whether or not there's been any reports of community spread or COVID infections through those events.
Okay, thank you both. And my follow-up question then is for you again, Dr. Richardson. I was just wondering if you can tell us what the breakdown is of Hamilton's active COVID cases, hospitalizations, and deaths by vaccination status.
Thanks very much, Maria. I think most of that stuff should be upcoming on our site if it's not already. James will get back to you with that breakdown, the specific numbers, but absolutely, we continue to see that most of our cases continue to be amongst those that are unvaccinated. A small proportion amongst those that are partially vaccinated, mostly because that's a very short period of time for most people. So there's a very small number there, and then only a small number amongst the vaccinated. But James will get back to you with a bit more of those specifics.
Thanks, Dr. Richardson. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Thanks so much. Sorry, I was having trouble getting off mute there. My question is for Dr. Richardson. Dr. Richardson, Board of Health heard yesterday that the last mile strategy doesn't appear to be as effective in rural areas of Hamilton. Why is it more of a struggle there? You know, what is the difference between sort of this area and the issues with vaccine uptake in the central lower area where the, you know, strategy has been more effective?
Thanks very much, Joanna. You know, I think it's really important to remember too, as we're talking about vaccine rollout, there's sort of the two pieces. There's us, you know, bringing the vaccine to the locations. There's us working with community members to make sure they understand the vaccine, have information on it. And all of our community agencies have been such a huge part of that. But as well, there's the choice in terms of the individual and how it fits. And we know for many people, it's quite a complicated decision to go through and decide about having a vaccine, about what their particular medical issues are, is what we've heard from some people. It is about hearing from people who are trusted parts of their communities, parts of their lives about vaccination and their thoughts on it. And so when we've been out, that's what we've heard sort of across the board. We have been out from an access perspective, out in that particular, what's called census tract area with many, many clinics in those areas. And we've had good response at many of those. But we continue to work with those areas to see, you know, what other things might it be that are causing people to choose not to get vaccinated in those areas at this point in time. So that's an ongoing piece of work for us. But we know in general across, it is those factors in terms of what are their own choices around vaccination, what are their own medical issues, you know, what are they hearing from others in their community, and that's why getting information out, making sure that people have factual information. We know there's been, you know, the parallel infodemic, as it's been called, and then working through what are the factors for them. So calling their primary care provider, calling our hotlines, even coming to the clinics and just talking it through, just showing up. You don't have to take the vaccine if you come, but you can certainly come and have a discussion about it. We're more than happy to do that.
There was a story this week in the Toronto Star that showed McMaster University has one of the lowest vaccination rates of the in Ontario. Is there something specific that Hamilton Public Health is doing to try to combat that, or to try and help McMaster boost those rates?
Yeah, working with our colleges, our universities has been a particular part of the program. We know that in that age group of 18, sort of now more 25 to 39, our vaccine coverage rates aren't as good as we would like them to be. They have been the slowest to come up. And so we've known that now for quite some time across Ontario. And that's why you've seen this work both by local universities and colleges, as well as public health units, to work with these groups to try and ensure that they have as much access to vaccination, as much information as possible. So we have been working with the McMaster Student Health Clinic to ensure that they have vaccine on site, and we have been providing clinics on site at McMaster, Redeemer, and Mohawk to assist with vaccination. So I think it's going to be an ongoing effort. It's part of that demographic, as I said, that we want to focus on and see them again make the choice to come out, get vaccinated. We know that sometimes people in that age group have other priorities, or may not feel they're as much at risk, but it is certainly a concern for us, especially for those that are living in residence and going to school on campus.
Thank you, Dr. Richardson. We'll go next to Matt Ingram from CHCH. Matt, you can go ahead.
Thanks very much for taking my question. I'm wondering, with the rollout of vaccinations to the 5 to 11 demographic, is the thought that perhaps kids would be vaccinated in their schools during school hours?
Thanks, Matt. With working with this group, we're trying to make sure that we're reaching them the best way that we can. At this point, we're looking at a number of different strategies. Some mainly in our mini mass clinics. There's going to be a specialty clinic again that our colleagues at McMaster Children's Hospital are going to put on, which helps for kids that are afraid of needles or who have special needs when it comes to vaccinations and need some extra support. We're going to continue to do it in our community clinics as well. So it's really going to be more a community-based strategy as we go forward.
Thanks very much. And just following up, we've heard a lot about, you mentioned the infodemic theories that it's not necessary to get kids vaccinated. I'm wondering if part of your rollout strategy includes any work to help skeptical parents decide that this is the right or wrong move for their child.
Yeah, absolutely, Matt. Working through the 12 to 17 age group, I think has been quite telling for us. We've actually seen a very good uptake in that rate. If you look at our curves that we publish in terms of their uptake, you'll see that they have accelerated faster than the rest of the community combined. And so we think this is really good evidence that both the kids in these age groups, because of course these are our younger adults and youth, and they are consuming this information and making these decisions often for themselves. And so it's been very good to see that uptake going on. We think that's going to continue on in the younger age groups. People are going to need good information though. And so our focus will be providing, up-to-date evidence around the vaccine, its effectiveness, its, the complications that may or may not have been seen with this, and making sure they have as much information as possible to make those decisions to come into our clinics. Of course, this will be very different than those 12 to 17, where very much parents are going to be bringing their children and being part of that process and decision making, even more so than they were for the 12 to 17-year-olds. So all of that is going to be a really important part of this particular part of the strategy. And our school boards are fantastic and partners in helping us to get information out to parents, both awareness around the vaccine itself and the clinics as we go forward. So it will indeed be a big part of the program.
Thank you, Dr. Richardson. We have a bit more time, so we'll go through for one more question each. I'll start with Lisa from CHML. Lisa, if you'd like another question, you can go ahead.
Thank you very much for the extra question. This will actually be for Jason. Just looking at the city's enforcement page and about the charges over the past week, I'm seeing the Esports Cafe on Main Street has a lot of charges against it, 12, and there are there's a whole variety of them. And it seems bylaw officers went there kind of 2 days last week. Just wondering if you could talk a little bit about that situation, what happened there? Was it complaint driven, or why is it facing so many charges?
So you're correct. There was a number of charges at that location, including a number of face covering charges. And I will say, just because we've been to an establishment on a particular day, it doesn't mean that it'll be weeks and weeks before we return. In some cases, we are going back multiple days in a row, especially where we have concerns about compliance. So you're correct. We were at that location a couple of times. And it is indicative of some of what we're seeing in terms of especially the face covering and the masking bylaw issues. And we've been advising establishments that when we do find those infractions, they've been in place for quite some time now, and that we are issuing orders and charges when we come across those types of violations. In terms of whether that one was a proactive or whether it was in response to a complaint, I'm sorry, I don't have that information in front of me.
Thanks, Jason. We'll go next to Maria from the Hamilton Spectator. Maria, if you'd like another question, you can go ahead.
Hi, thank you for the extra question. I just wanted to check with Dr. Richardson. You mentioned that the vaccination breakdown that I asked about would be made available online soon. So just wondering if you can say how soon that might be.
Maria, we'll follow up. I'll confess I'm coming back after a couple of days off this weekend, so my dates aren't always as accurate as they could be. So James will get back to you with the specifics on that.
Thank you. We'll go next to Joanna. Joanna, if you'd like another question, you can go ahead.
Yes, thanks so much for the extra question. Really appreciate it. Dr. Richardson, this question is for you. Has Hamilton Public Health started giving out third doses to the cancer patients who became eligible in mid-September? I know there was a group that became eligible in August and another group in mid-September. And are there special clinics for them, or how do they get their third vaccine?
Thanks very much, Joanna. This is a group, of course, that is particularly important because they are vulnerable both to the disease and having more severe complications from the disease. And as well, vaccination is a tougher piece for them. It takes the third dose, as we're talking about now, but as well timing that dose if the reason for their immunocompromise is due to medication, chemotherapy, that sort of thing. So yes, since the group was announced back on August the 17th, they did become, a certain group became eligible at that time for the vaccine. It was expanded, as you pointed out, on September the 14th. And initially as well, the process was that people who were in this group had to get a note from their care provider, their physician, their specialty clinic, whichever it might be, their family doctor, to say that they were eligible for the vaccine. And then they have been able to bring that note to us in our clinics now for some time. With the recent changes that the province put in place, these people are now able to come forward with a prescription that shows their medication that they were on, or something else that their provider might provide, in order to go to a pharmacy. Pharmacies are now eligible as well to provide vaccines to this group, as well as in our clinic. So we're trying to make it as easy as possible for this group to come forward and get prescribed, so they could bring a bottle of their medication, packaging that has the prescription on it, their name first and last, the name of the medication, and their telephone number, and that can be brought so that that can be given. So as I said, very important group. This group is eligible at 8 weeks after their first dose after their second dose to get their third dose. But as well, they need to speak with their treating physician if it is a medication or a disease that is causing them to be immunocompromised, to talk about exactly what's the best timing for them.
Thanks, Dr. Richardson. We'll go back to Matt from CHCH. Matt, if you'd like another question, you can go ahead.
Thanks very much. Dr. Richardson, one more follow-up on the kids' vaccination. I know that your plan is now being reviewed by the province. How long does that take, and how soon do you think you'll have it back so that you can start telling parents how this is all going to work?
Yeah, thanks, Matt. It's usually pretty quick. What happens is the province gathers those all together until they have those now, and they go through them and then come back to meetings with us to talk about, what they saw that were really good things that they would like us to share across, that we might be able to pick up, what might be areas of improvement or barriers that we've identified to vaccination that we need some help on, or that the province can assist with communications or whatever it might be. And so that usually happens over a couple of week time frame. And so I would expect to get that moved through over this week and next week, and then look at finalizing our plans following on that.
Great. Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So we'll pass things back to you.
Thank you very much, Jasmine, and thank you to our media partners for your questions, and hopefully you'll get some answers to share that with your readers and listeners and viewers. Thank you so much. And Cable 14, Bill Custers, and the entire team at Cable 14 and Clear Cable, thank you as an ongoing effort to put these media briefings together. And if you need more information on COVID-19, financial supports, or any of the updates, visit our website at hamilton.ca/coronavirus. And we ask you to please continue the good work you're doing out there, being cautious, wearing the mask, getting vaccinated. All of those measures are making a difference, and you do your part as part of our community is very, very appreciated and very, very helpful. You can find the latest information on the city's website about vaccinations or anything having to do with the coronavirus at hamilton.ca/coronavirus. Or you can follow us on social media. So that's it for today. Thank you for tuning in. We look forward to talking to you again in a couple of weeks, or as required if anything comes up in between. Thank you all. Have a great day.